Okay, so you made it to the last video. So when my surgery happened and I got my pathology report back, it ended up being a fibroadenoma with usual ductal hyperplasia. Hyperplasia is like a characteristic of a fibroadenoma. So before I actually went in for my results, I researched every benign lump that I could find, fibroadenoma being one of them. There's so many different kinds. You could have fibrocystic breasts, you could have fat necrosis, you could have cysts. There's so many. You could have a rare tumor called a Phyllodes tumor. So I like literally sat there and I wrote down like all the stuff that I found. This is, and fibroadenoma is on here. But so is hyperplasia and like fibrocystic, everything. So I'll type this out and I'll leave it for you guys. But I kind of wanted to emphasize maybe why a biopsy is important. So the reason that I decided to actually do surgery and not do a core biopsy is when you go in for your ultrasound, your lump might look something like this, right? And the doctor might be like, hey, you have a fibroadenoma. You won't really know if you have a fibroadenoma unless you do a biopsy. The best type of biopsy to do is surgery because you're removing the whole lump. So obviously it's going to be the more accurate one. Versus if you do a core biopsy, they're literally just going to take pieces of it, and the pathology report won't be as accurate versus removing the whole lump. So what actually motivated me to want to do surgery versus core biopsy is, my lump was 3 centimeters big, and it actually didn't bother me, but like I said, there's other lumps besides a fibroadenoma. So when I was researching, I came across something called a Phyllodes tumor or Phyllodes tumor. They basically look like fibroadenomas on the ultrasound, but it's not a fibroadenoma. It looks exactly like a fibroadenoma, but the only difference is Phyllodes tumors tend to be bigger, like 3 to 5 centimeters. But based on image, this could definitely look like a Phyllodes tumor. And because my lump was 3 centimeters big, I thought maybe I'll have a Phyllodes tumor, not a fibroadenoma. The thing about having a Phyllodes tumor is it is benign, but it has a high reoccurrence of coming back. So you could have a Phyllodes tumor and it could be benign, or you could have a typical Phyllodes tumor where it's in between, or you could have malignant Phyllodes tumor. But that's basically what motivated me to get the surgery. And I also read cases where if you do a core biopsy, it'll say you have a fibroadenoma, right? And then the girl will eventually go back 2 years later and do a surgery, and that lump will end up being a Phyllodes tumor. But the core biopsy said fibroadenoma. So it kind of makes a difference when it comes to situations like that. Having a Phyllodes tumor, it's not breast cancer, it's just that there's a high reoccurrence of coming back. So that's actually what motivated me to get the surgery done, because my lump was 3 centimeters big, and I thought, well, what if this is a Phyllodes tumor, not a fibroadenoma? Because Phyllodes tumors, they're really rare though, but there are some people that have had it. I've talked to a couple people, and basically you have to be monitored a little bit more if you have Phyllodes tumor versus a fibroadenoma. But anyways, this list right here, I'm going to leave it down below. And I want to talk about pathology terms with you guys, and then the risk of surgeries. So any biopsy you do, you're going to get a pathology report. It might come back, it's usually like maybe like a small paragraph, but the words that you want to look out for is, well, the good words are called benign, meaning not cancer, but the words that are kind of tricky is words for precancer. So the precancer word would be atypical, malignant, any biopsy you do, but specifically for the breast, if you have atypical or malignant cells, atypical for sure, they would consider that like a precancer. And then the word cancer means carcinoma. So anything that's a carcinoma is cancer, lung cancer, breast cancer. If you get a pathology report, it's not going to say you have breast cancer. It's going to say breast cancer is ductal carcinoma or luminal carcinoma. The word carcinoma means cancer. That is a medical term. It's not going to say breast cancer, it'll say carcinoma. So definitely, like, if you don't want to watch the images, at least know the words. So you're going to look out for the words atypical and malignant. Those would be pre-cancer according to the breast. And the word carcinoma, no matter what you're doing, that is a cancer. So let's just say this. Let's just say you get your report back, right? And it's like, hey, you have a fibroadenoma with atypical cells. It's still a fibroadenoma, but it's a little bit of a higher risk. It's more like a, I guess, a pre-cancer, but let's just say your fibroadenoma says atypical cells. Don't really freak out about it, because the only thing that they could do is just monitor you more. You're not gonna, they're not gonna be like, oh, you have breast cancer because of typical. You just have to be monitored a little bit more if your fibroadenoma happens to have atypical cells, or let's just say you have a phyllodes tumor and it has atypical cells, or any type of lump that has the word atypical. They're just going to monitor you a little bit more. They might tell you to come back in 6 months. Also, some doctors will give you like medicines to reduce your hormones. But basically, atypical is considered a precancer. You just got to be monitored a little bit more. Now, if it comes back and it says the word carcinoma, then it is going to be cancer, like breast cancer. There's also rare, like I think triple A breast cancer or something. But carcinoma, look out for. I'll leave all these words down below along with that ultrasound video. And my last thing I want to talk to you guys about is the risk of surgery. I'm not talking about anesthesia, but I want to emphasize this because this happened to my mom. And I thought it maybe happened to me. So I decided to get surgery done. The name of my surgery was called breast excisional biopsy. It wasn't a lumpectomy. My doctor basically went and removed my whole lump. She didn't take the surrounding tissues. I guess that's what a lumpectomy is, if you take a wider margin. I just got my whole like lump removed. And after I got my surgery done, where she cut me, I noticed underneath it felt kind of hard. It didn't feel hard as a lump, but it felt hard. So I asked my doctor, and she says that wherever you cut something underneath a capsule forms. Basically, it's like a little like pouch of like liquid. It'll form underneath your scar, and eventually it'll disappear. So after, I want to say like 7 months, I noticed that underneath my scar, that lump disappeared, because I was kind of freaked out a little bit. Like, I just removed my lump, right? And I feel something hard underneath. It wasn't as hard as my lump though, but you definitely could feel something. Basically, it was like a ball of liquid. And that will happen if you do surgery. It might happen if you do a core biopsy. I'm not sure, since I didn't do that. Now, I want to talk about my mom experience. So my mom actually did the same surgery as me. She removed her lump, and then a year later she went back and did breast reduction, because her boobs are pretty big. So she wanted a reduction. You could also actually do remove your fibroadenoma and do a reduction. You could do that, but we decided not to do it for my mom because we just wanted to make sure she didn't have breast cancer. So we went back for the reduction a year later. But basically, this is what happened to my mom. So my mom got her surgery done, right? And same thing happened. She noticed that underneath it felt like hard. It almost felt like liquid too. And I'm like, hey, it's probably just like scar tissue. And then like a year later, she did her breast reduction surgery. So my mom ended up getting something called fat necrosis. That happens when you do any type of surgery. You could also get it when you do core biopsies. When you do a core biopsy, that's not even surgery. Anything, I guess anything that touches the fat and like cuts it, you could get something called fat necrosis. And basically what that is a lump will form, and it will feel hard. It will literally feel like a lump, like a fibroadenoma or like a cyst. And this happens when you do a core biopsy or surgery. My mom actually had this twice, but I thought she just had like a liquid of capsule like I did. I actually technically could have gotten fat necrosis myself, but basically if you do ever get surgery and you feel a lump and it doesn't tend to go away, it might end up being fat necrosis and not like a ball of liquid. You'll know it's fat necrosis because you have to get an ultrasound done, and on the ultrasound the image will be hard to see. I know what fat necrosis looks like, but if any of you girls have gotten surgery and you feel like really hard underneath, if you feel like you found another lump, You guys could always talk to me, and I would definitely suggest getting an ultrasound done. If it is fat necrosis, the thing is you get that because of surgery trauma. If you do another surgery, you could get another one again. So I just want to emphasize it because, you know, you're going to get surgery done to remove a lump, but if you end up getting another one with fat necrosis, it's just good to know. It sucks because people who get fat necrosis, you don't know if you're going to get it or not. So it's a risk to take, but it's bittersweet. It's a risk that you're kind of willing to take. I mean, yeah, my mom removed her lump, but she got another one. But the second lump ended up being fat necrosis, which happens because of surgery. You know, you cut your fat and your fat ends up dying, and our breast has fat in it. But it's just something I wanted to like give you a heads up. So in total, I made about 3 videos, and if you guys, you know, want to message me, you could find me on FB. My name's JJ Kelly, and you could just message me if you want to be my friend. You can. I could also do like a Q&A. I feel like my videos are all over the place, so I could answer specific questions if you want. But basically, I just wanted to give you a guideline and talk about my experience, and you know, just help you guys out. I definitely could make you more videos. Just leave a comment and let me know. Basically, I'm just going to leave you the URL of this ultrasound video that I found. And later on, I got to type all this up for you guys and just leave the list. But if you have more questions, I could totally answer it for you. This list just talks about the different types of benign things. It's just like a list. I didn't really explain it as much. But, well, some of them I did, but I don't want to overwhelm you guys. So if you have any questions, just let me know.